holy smokes, look at all of this. This is all the medication that is going to be used for our upcoming modified natural frozen embryo transfer. This is the Lovenox, my autoimmune protocol. I am supposed to take one of these daily. Here's what that looks like. It's a pre-filled syringe. It's a blood thinner. Essentially, this will just help with inflammation and with any of those like autoimmune concerns that would potentially lead to like a blood clot. And unfortunately, those were the ones that actually burned the most. So not really looking forward to my friends over here. And then we have the Pregnal or HCG. So you'll have to dilute it and use the needles right here that they gave us. And really by we, I really mean Brady, because let's be real, I don't do any of the mixing, the prepping, or giving myself the shots because I really just don't want to mess up. And he knows exactly what he's doing. He's done everything in the past, which I am so grateful for. So thank you, Brady, very, very much. Anyways, the HCG, the Pregnal, is your trigger shot. It's going to mimic the LH surge and really make it predictable for when I'm going to ovulate and help them find that exact time for a perfect embryo transfer. And then we have Prednisone. So essentially this is a steroid. It helps suppress my immune responses in case there's any that might reject the embryo. Low dose naltrexone. That's one thing with the autoimmune protocol. We're really trying to make my body less inflamed and more receptive to that embryo and implantation. And then there's Letrozole. Essentially what Letrozole does is it helps thicken the uterine lining and really making it more of a receptive place for the embryo to implant, increasing that blood flow and just really being that positive environment for little embryo. So we want that because we want baby hand. Next on the list, we have tacrolimus. At least I think that's how you say it. From my understanding, what this one does, it's a supplement to help really stay pregnant. Moving on to the progesterone. These are actually suppositories, but essentially the progesterone, I don't have to take the progesterone in oil shots, which were the booty shots. Woo woo! I am forever thankful for that. We have doxycycline. This essentially helps improve the implantation success rate, making it more favorable. So ultimately, all of these, yes, so many. Most of them are really just to help my body prepare and be in a really good environment for an embryo transfer. I got one more medication in the fridge. That is wild. So this little thing right here is $209. And it's like not even full. It's like a third of this. That is absolutely insane. What Neupogen does for me on the autoimmune protocol, it will increase the white blood cell count because generally those tend to lack when you have an autoimmune disease. If this video helped you gain clarity on what to expect during an IVF frozen transfer, I hope you hit that like and subscribe button. And if you're in the middle of a cycle or just your infertility journey, just know that I see you and I'm with you and I'm cheering you along every step of the way. So sometimes messy, always real. Let's do it together.